Hello, my name is Jessica Melcher and I'm a social work consultant with Advanced Health Institute. Today I'm here to give you a brief introduction to trauma-informed care. The Phase III rules of participation require that skilled nursing facilities implement trauma-informed care. Let's take a look at Statute 483.25M, which reads, "The facility must ensure that residents who are trauma survivors receive culturally competent, trauma-informed care in accordance with professional standards of practice and accounting for residents' experiences and preferences in order to eliminate or mitigate triggers that may cause re-traumatization of the resident." Trauma-informed care is not something we provide in a singular approach, but rather is incorporated into different elements of care, the first of which is comprehensive assessment. We need to screen all of our residents for a history of trauma so that they may receive appropriate services. Through person-centered care planning, we need to outline the individualized services and interventions we plan to provide. And through staffing, we need to provide adequate and well-trained staff that are able to deliver that care. Let's start with some definitions. What is trauma? Trauma results from an event, series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, emotional, or spiritual well-being. Trauma can be complex, meaning it results from multiple events over time. This might include child abuse or child neglect. Or it can be acute, the result of exposure to a single event, such as a natural disaster or one physical assault. Trauma is also highly individualized, so one event might have little to no impact on one person, and it might be highly traumatic to another. The types of trauma are complicated and many-layered. It can be the result of natural or human-caused disasters, such as a hurricane versus a train derailment. It might be accidental or intentional. Trauma is often interpersonal, meaning resulting from relationships. Examples include domestic abuse, sexual assault, or elder abuse. It might be developmental. Adverse childhood experiences, or ACEs, are now known to have significant negative impact on people over time. And trauma might affect one individual, a specific group, a community, or people en masse. We now understand that the prevalence of trauma is quite significant. Trauma is no longer considered an abnormal or unique experience. In fact, studies indicate 61% of men and 51% of women in the US report at least one traumatic event, and up to 90% of clients in public behavioral healthcare settings have a history of trauma. It's important that we understand triggers and the risk of re-traumatization. Triggers are sensory stimuli such as a sound, sight, smell that remind the survivor of the past traumatic experience and signal possible danger again. This can lead to re-traumatization, which is the conscious or unconscious reminder of past trauma that results in re-experiencing of that initial traumatic event or situation. Why is trauma-informed care important in a skilled nursing facility setting? We know that transition to a nursing home in and of itself may trigger re-traumatization. Triggers can include a lack of privacy, crowded spaces, loud noise, bright or flashing lights, unknown people touching and providing personal care, having many people giving direction or asking questions, and having a feeling of confinement. The effects of trauma are widespread and profound. We know trauma has a holistic impact on individuals, meaning it can affect them biologically, psychologically, socially, behaviorally, and spiritually. Survivors may have difficulty with emotional regulation, are more likely to be diagnosed with a mental health disorder, to experience chronic disease with poorer physical health outcomes, and to engage in substance abuse. It's important to remember the 4 R's of trauma-informed care. Trauma-informed care realizes the widespread impact of trauma, so we are aware that our residents have trauma in their background. It recognizes signs and symptoms of trauma in residents. We get to know our residents as individuals and what their history and triggers might be. It responds by incorporating knowledge about trauma into policies, procedures, and practices. So we are training our staff to deliver the best care possible to treat and prevent trauma. And it resists re-traumatization. Our goal is to prevent our residents from exposure to triggers without support and sensitivity. Thank you so much for joining us today. I hope this was a helpful introduction to this topic. Please contact us if we can further assist with trauma-informed care.